Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
All right, here we go again. Another community service program here on KGAF. Today's the day we talk about goings-on at Muenster Memorial Hospital, and Brian Roland, the CEO of MMH, is with us. How are you, sir?
Hey, good morning. I'm doing great, and I'm really excited to be here this morning.
It's always good to have you here. Get caught up on some MMH talk here. First of all, February is something, and I know your hospital is involved, but hospitals and healthcare facilities all across the country are involved in Heart Health Month every February. Talk a little bit about that.
Yes, February is Heart Health Month, and it's really important for people to take the time, get checked out. You know, even if you're feeling all right, if you don't have issues, 25% of the deaths these days are related to heart-related problems, and it's very, very important if you do some small changes. Go see your doctor, see your cardiologist. If they suggest that you have a test done, take the time. Do what they tell you to do, because realistically, you only have one heart. Mm-hmm. You really need to make sure that it's working to its fullest to be able to utilize it for as many years as you hope to have. Personal experiences for me, it'll be 15 years ago, August, I lost my father to a heart attack. And actually this morning as we speak, my mother is in the hospital down in Dallas having a heart cath done as she prepares to have aortic valve replacement surgery done here in about a week and a half. And so it's those little things that if you look at them now can help. A lot of things can be prevented if you eat right. And I'm not a doctor, but if you go to your physician, listen to them, because the heart, once it goes, it goes. Mm-hmm. And so our goal at Muenster is, we have our cardiology program. We have the cardiologists that come to our specialty clinic. We have the tests that we can do through our cardiac rehab program, our cardiac stress tests, our nuke med stress tests. If the doctor suggests you get that, it can be as easy as your blood pressure check. And those aren't painful. Right. And get it done. Spend the time. The American Heart Association talks about the little things that you can do. Just spend the time, make it happen, get it done. Yeah, very, very important. And again, if you're out there and you don't have a cardiologist, you feel you may need to start seeing one, just talk to the folks at Muenster Memorial. They can make some recommendations for you without a doubt. But again, February, Heart Health Month. All right, let's just talk about some of the goings on at MMH these days. Brian, what's happening? So we've got a ton of things going on as normal. Our big thing right now is how do we strengthen the healthcare program that we have for Muenster first, and the hospital district and Cook County as a whole, because we truly feel that we want to be an integral part of making sure that Cook County has the best healthcare that it can have in the area. And so there's a lot of things that we're working on. Our home health department actually has just moved back closer to the hospital. We are doing a lot of programs with them. They're doing a lot of outreach programs to get the word out on what we do and how we do things, and all of the different things that home health can do for you, and the different aspects and what it takes to become a home health person. We're also working with Dr. Crow Rodney, who will be coming on board here in the next month, which we're really, really excited about, getting her here, getting her up and going. One of the big things that we're going to be doing over the next 3 months that a lot of community people will hopefully get involved with is a community needs assessment. I think it's good for us to look at, instead of just trying to kind of guesstimate on what we think we should be doing for Muenster, for the people of Muenster, is what do you think we need to be doing? Are there programs that we need to look at putting in place that will help bring people to our facility, but also help our community become more healthier and more stronger as we continue to move forward? And at the same time, we continue to renovate a lot of our rooms. We've gotten a couple of the rooms done now. We're doing 2 rooms at a time, so we're just taking little bits of time and making the place look a little cleaner, putting a new face on some of the stuff. We'll be painting the clinic here in the next 2 weeks to go along with the new flooring. And at the same time, we're getting ready for our election that's coming up. We've got 3 board members that are up for re-election, so we will be working on that. One of the things that we're really looking forward to is the Muenster Chamber March mixture is going to be at our facility, at our clinic on March the 9th, where people can actually come out and see the clinic, see what's going on, talk to our staff about what's going on at the hospital, and just kind of have a good time to see what's going on in Muenster. So just that's probably 6 of the 28 things that are on my whiteboard at this time. So just a lot of stuff.
I want to go back just a second here to the community needs assessment. I know this is the first time that this has been done, at least in memory, by the hospital. And when you do these things, I think it's normal to have expectations and think that maybe you know how it's going to come out, but at the same time, do you expect any surprises at all in this? Anything you hadn't maybe thought of?
It's really different because the way you break the groups up to have the conversation, it's going to depend on what they feel their needs are. You take that data along with the data that we already get based off of the clinic volume and the hospital volume. So a lot of times you don't see a lot of things that you didn't plan on, but it gives you a little more perspective on the priorities on what you think you need to work on. Because when you're talking to health, the leaders of the community, the people in the community, the board members, everybody's kind of looking at a different piece, and so you just never know. There may be something out there that none of us have thought about because it's just you just don't sometimes.
Right. All right. The legislature well underway with things in Austin, and talk a little bit about that and what's going on regarding health care.
There's so much stuff going on, and I think it's really interesting. The Affordable Care Act, there's a lot of talk about changes in that, and it sounds like there's really not going to be a whole lot of movement on that until mid-2018, so we're kind of preparing for that. We do have the Rural Healthcare Advocacy Days coming up February 20th in Austin, so there will be a lot of rural healthcare people down there talking about the issues, the challenges, everything that we deal with. And I think the interesting thing is, and I feel somewhat sorry for our current president. I believe his pen has run out of ink 3 times with all the stuff he's been working on and changing.
Yeah.
So there's just so many challenges. Hospitals are closing. Hospitals are filing bankruptcy. There are so many things that we're working towards. The legislative folks in Texas alone, there's some 962 bills that are already they're talking about and how they get prioritized and where we fall into that as a rural healthcare entity and healthcare as a whole and what that game plan is going to be.
Yeah, it's going to be interesting to watch and see what happens. There's no doubt that rural healthcare today is a rather slippery slope, I would say, just being able to keep your head above water and give the great services that the community deserves. And you guys certainly doing a great job of that at MMH, and wish you continued success.
Well, and I appreciate that. And Winston Churchill has told us, success is not final. Failure is not fatal. It's the courage to continue that counts, and so that's one of the things we have to look at. And then the other piece that he says is the pessimist sees difficulty in every opportunity. The optimist sees the opportunity in every in everything that's difficult, and that's really what we're doing. We're the optimist looking at how do we do these things in all of these difficult situations.
Well, and that's the best approach all the way around. Brian, we're out of time. Appreciate it. We'll do it again next month.
All right. Thanks a lot. We'll talk to you later.
You bet. Thank you very much. Brian Roland, CEO at Muenster Memorial Hospital. It's going to wrap it up for our community service program today, right here on KGAF.